This particular boy, who is a 13-year-old boy, he was otherwise very healthy, active, good in academics. All of a sudden, he had pain on the left side of the chest. On investigating, he was found to have around 5 centimeter of tumor on the posterior chest wall. Lungs were normal, lungs were not involved. So they underwent a needle biopsy, which came out to be a benign schwannoma tumor. So we took up this child for the robotic surgery, and robotic excision of the schwannoma tumor was done in toto without any spillage. So we have used our SSI Mantra 3, and the recovery was beautiful, and child was discharged on third day of surgery. When it comes to children, first of all, a sick child is of great concern, and that too, if you say the treatment is nothing else than the surgery, then it is extremely difficult to convince the parents, because it involves not only the surgery, the cut, the healing, the infection, the anesthesia part of it. Parents think that as it is, a child is suffering from the disease and the surgery is going to add to more sufferings. So it is a very anxious part which we need to deal with it with a lot of patience. Some parents who are educated, who have already done their groundwork, they are well informed about it, but still they have somewhere in the corner of their mind that if at all this doctor gives a treatment which is something else other than surgery, they'll be more than happy to embrace it. So yeah, but when it is surgery and nothing else, we are very straightforward about it. We take some time to convince them about what the child is having, and we show them some educative videos. I draw it on the pen and paper in the language in which they can understand, and I then put in black and white what are different options, and so far how we were dealing with the open surgeries, what are the consequences, and now we are turning to the minimal access surgery. We were also doing thoracoscopic surgeries and robotic surgery, how advantageous it is over the other modalities of treatment. We have done a wide range of surgeries, right from child as small as 1 year old till the age of 15-16 years. So first is a small child was 1 year old who had a very big hydronephrosis. He has undergone a pyeloplasty using 3 arms in Mantra, and it's very convenient for us because we are able to position the arms in a convenient manner in such a way that there is no collision. So a lot of homework is done, mapping of the port placement is done after the positioning is done, and we study the correct angles in which we need to put the instruments. We select the instruments very wisely so that we don't waste time in changing the instruments in between. So that's how we are able to take our surgeries forward. Initially it took some time, but now after finishing 15 cases on SSI Mantra, we are quite confident, and even the docking time has come down, and even the selection of instrument has narrowed down, and with the newer instruments introduced in Mantra System 3, we are able to do the surgery in much lesser time. The best part of it is especially in the pediatric surgery, where we have to have one-to-one coordination with every team member, whether it is the assistant or the anesthesiologist or the assisting nurse, where they should be loud enough to tell their concerns, what is happening on the bedside, and the surgeon is able to ask questions or communicate very freely. So that is possible because the surgeon console is an open system, and the vision which the surgeon is seeing himself or herself with the 3D vision, it's the same vision what the team members are seeing with their 3D glasses on. And when it comes to robotic surgery, it is nothing but a different stage or a higher advancement in the minimal access surgery. Only difference is we are using the robot, and the strain on the operating surgeon is less. So the acceptance will be much quicker than compared to the laparoscopic surgery. accessibility is only concern. Once it is accessible to the surgeons, then I am sure most of the surgeons would like to use robotic surgeries for all the difficult cases which they are performing either by using laparoscopy or by the open surgeries. So when it comes to pediatric surgery, most of the diseases are by birth. So congenital anomalies, as of now in our country, it is not covered by the insurances. Now we see that more and more the young parents, they are aware of these health insurances, and as soon as the child is born, they get the insurance done. Some of the insurance companies which are corporate insurances, they do cover these birth defects, but to large extent the birth defects are not covered. The biggest concern or the anxiety was regarding the cost, because it's not just the initial treatment, the follow-ups and the further treatment, lifelong care for the child is also to be looked into it. When it comes to SSI Mantra, I can say that definitely the availability of this system is so wide. Even in Tier 2 city it is available, and surgeons themselves are also taking a bold step to get themselves trained with this, and they are trying to convince their patients to get the treatment done, because the advantages are outraging the disadvantages of the surgical treatment in even young children. SSI Mantra is coming up with the more and more designs which are innovative, which are incorporated especially for the pediatric surgical cases, because by and large, compared to the adult population, the pediatric population which requires the robotic surgical interventions is very small. So none of the companies are really interested in investing into a system which is exclusively advantageous or size-wise it is feasible for the young children. So I'm happy that Dr. Sudhir has been kind enough to look into this, and as a part and parcel of his entire project, he is also giving a thought to the pediatric cases, which can be also given the advantage of this particular robotic system. All those pediatric surgeons who are using other systems, they should have a hands-on on this and try the cost effectiveness and try to use this, and they should show their talent and give the advantage of their robotic surgical talent skills to maximum population, taking the advantage of the cost using this system.